Welcome. My name is Sam Taylor. I'm the host of We Are Broomfield, Community Spotlights. Today, we're talking to Susan Vellas, the program manager here at Mental Health Partners. How are you doing today, Susan?
I'm good, thanks, Sam.
So tell me a little bit about yourself and what you're doing here at Mental Health Partners.
I've been in mental health for about 25 years plus, and I moved out to Colorado almost 10 years ago. I got a great job at the Mental Health Center working in our day treatment program with kids in a school setting. I loved working with the adolescents and the little kiddos. And then a couple years ago, I switched over and I did some training for a few years. And then I've been here in Broomfield as the program manager for about 3 years. And we just recently added a Lafayette office as well. So I also supervise the staff in that program.
So Mental Health Partners is larger than just Broomfield.
Yeah, it's actually a huge organization. We have like over 500 staff, and it's both Boulder and Broomfield County. And so it's pretty powerful, the breadth and width of the different services it has throughout the communities.
So what are some of these services that it provides Broomfield and Boulder counties?
Well, in Broomfield, we have our outpatient office here. And so we have a staff of about 15 folks. Predominantly 6 or 7 of them are therapists. And so they do more of that traditional outpatient. So people might come in. A lot of times people are struggling with anxiety or depression, and so they'll do ongoing counseling with them. We do work with children and families as well. So that's definitely a piece of it. And then we have case managers on our team that help folks figure out what resources in the community they can get connected with. And then we also have a couple prescribers and a nurse who help people who might need psychiatric needs, medications.
So how long have you been providing services to the residents of Broomfield?
So we've been in Broomfield for like 25 years. So even before it was a county and city itself. And you know, part of helping this community, having a specific site located here so it'd be more convenient for adults and families to come in. So the best thing that happened is a year and a half ago, we got to move into this building, which is great because now we're just all in one-stop shopping. You know, we're in the Broomfield Health and Human Services building. We're up on the 2nd floor. So workforce is downstairs. The child welfare services is upstairs. And so we get to be part of all those other community resources. And so it's easy for our folks to find us. And you may be at one place and you can, you know, come up and say, okay, I'm getting my appointment here. Or we try to access and say, oh, let's go downstairs and have you get your benefits hooked up. So it's really locally here so that everybody in Broomfield can take advantage of their services that are here for them.
So you deal with the full range. Now, I heard you mention depression and anxiety. Are these like 2 of the largest mental health issues?
Definitely. I think that's something probably most people can relate to as far as struggling with anxiety, very common. Really if you look over a year's time as an adult, that 1 out of 5 of us will have a diagnosis during the year. And a big piece of that is anxiety or depression.
So 20% of the population in a year will be diagnosed. That's huge.
I know.
Now, what about people that aren't diagnosed?
Great. But I think what ends up happening is when you think about mental health, it's really pretty common, and that it can include also substance use. As far as it's either impacting me right now or it may be impacting somebody in my family or one of my good friends. So it is pretty widespread as far as the impact across our families and our communities and ourselves.
So 1 out of 5, so over the course of a person's lifetime, what are the odds that an individual will be diagnosed with some type of mental health problem?
So it's almost 50%. So if you think about that, it's either you or I at some point in our life are going to have a diagnosable mental health.
So if half the people are going to have a diagnosable issue, that means pretty much everybody is dealing with it as a family member, as part of a group workforce, something like that.
Yep.
So this is a huge issue. So why is there reluctance still to this day for people to talk about mental health issues?
That's a good question. Sometimes I forget because I'm in the field so much. I just think it's okay and it's acceptable, but I still think there's a lot of whether it's in your culture, that it's not okay, that you should do it on your own, that you should pull yourself up by your bootstraps, that kind of thinking, or there may be some embarrassment and shame. I think the other piece that happens is there's a lot of trauma, so people who have been hurt by other people, so when you have your trust broken, it makes it even more difficult to come in and ask for help. So I think there's some reasons behind it, but I'm hoping that people become more and more comfortable because there's a great resource out there. The wonderful thing about it is 90% of the time, counseling works. I mean, that's better than like heart surgery odds. So it really can make a significant difference.
So counseling, number one way you go at it to deal with the problem. So is this one-on-one counseling? What kind of counseling is most effective for the different issues?
That's good too. I like what you're thinking because one of the things we really are into in our office is providing group counseling. And there's always kind of a hesitancy for people to go to group counseling, but once they get in it, they realize how vital that has been, and they really connect with other people who are either struggling with something similar. Sometimes they're able to help the other person, you know, share resources, or just knowing you're not the only one going through something. So we have a lot of group counseling, as well as we do individual therapy and family therapy.
And I assume, like you said, group is tough for people to get into because they look at it and these are total strangers when they first start. But they're expected to share what they might think of as an embarrassment or something that they really struggle just to come to see somebody about.
Yeah. And I think there's something powerful. There's a little bit of that vulnerability where somebody else shares and then you're like, oh, it's okay for me to share. And so then that person takes the risk and you try it out and you say, okay, I feel comfortable. And there's a leader in there and they're helping keep things safe and that you can trust. And it really is a supportive atmosphere from each other. So it's pretty powerful.
And the leader, of course, is a trained therapist.
Right. Right.
That works for mental health partners.
Mm-hmm.
So what are some of the other treatments and some of the other issues besides depression and anxiety that you have to deal with on a daily basis?
Well, probably the most common thing is also just being impacted by trauma. So it may be that somebody has PTSD, post-traumatic stress disorder, or other impacts of trauma. And so then there's certain trauma protocols that will fall to help somebody kind of first feel safe, build up some coping strategies, and then process both the emotional and cognitive impact of that trauma.
You know, that makes perfect sense. A lot of people don't think about that, but trauma can have long-lasting effects, especially if it's physical trauma, mental trauma from somebody they trusted in the past.
Right, medical trauma even.
Even medical trauma.
Yeah.
I never even thought about that. I mean, that's big.
Mm-hmm.
So right now in America, we have an opioid crisis. How is this tied into mental health, or is it at all?
Well, I think definitely. Sometimes I think there's vulnerabilities. If I'm struggling with depression or I've had something traumatic happen, I may end up using a substance to try and cope with that because it's overwhelming or I need to take a break from those emotions. So you can kind of understand why a substance might be a coping strategy. But eventually that becomes the problem itself. And when you're trying to alleviate your pain and you're like become in a relationship basically with that addictive substance, then that becomes the most important thing. And it really starts to run your life instead of you running your life.
So it's a tool that could be useful in certain circumstances, but right now with untrained people trying to self-medicate, that's a good part of the problem.
Right. And it's the idea of maybe whether you're using counseling or other supports in your community or your spiritual life, to find other resources of like, how do I manage this pain or how do I manage this emotion instead of relying on something that in the long run is going to end up actually hurting me more than helping me.
So if people want to reach out, either they have a problem or they know somebody has a problem, how do they get in touch with you or mental health partners?
Right, so they can call our general line, which is 303-443-8500. And then we have these great care staff that answer our phone, and they just help people get directed to find out, are you even in the right place to start with? So another resource also if somebody's having a crisis is the Rocky Mountain Crisis Line. So this is available 24/7 across the state. which is a great thing that they made available a couple years ago. And that number is 1-844-493-TALK, or 8255.
Okay, so there is a 24-hour hotline that somebody can call anytime, 24/7,
Yes.
and get help they need. Now, we're here, your office is here in the Broomfield Health and Human Services building,
Yeah.
where we're doing this interview. Can they drop in? Can they just stop in, or is that not really advisable?
So they can stop in, they can call. If they stop in, it kind of also depends on what their payer source is. So for Medicaid clients, there's an availability of being able to meet with the case managers and starting the process of becoming a client. For our commercial clients, it's better if they call, and we'll probably get them scheduled with somebody yet to make sure they're actually credentialed on their panel. So it would be better for them to call.
That makes perfect sense. Now, you touched on the Medicaid and commercial insurance. Are mental health issues covered by insurance in all aspects?
Well, it depends on your policy. So I would say in general, yes. And so sometimes your policy may be the one deciding on how many sessions you have. But yeah, in general, substance use is covered currently, and mental health as well.
So, Susan, tell me one of the most rewarding aspects of your job. What has happened here that really makes you think what you're doing makes a difference?
Yeah. Well, I was saying we have lots of great groups, and I really do love group therapy, and I believe it's, for some things, it's really the best treatment. And I also really think doing family work can be incredibly impactful. And I was lucky enough to work with this young man. He's an adolescent, and his adoptive family. And they had a lot of struggles, and he had a lot of behaviors, and there was a lot of issues related to early trauma and neglect. And the family was willing to do the work, and the young man was also able to do some work, and we talked about their trauma, and we worked on their relationship and how they could really connect, and how the parents could help him with his emotions and co-regulate. So that attachment work and that family work to me was great, because even though it took a long time, in the long run, I think it was really helpful for them, and to be able to be part of that growth and them coming to a more stable place in their life. It just makes you feel great to be part of that and see that happen.
Well, I assume mental health partners, similar to a lot of other nonprofits, their resources just don't quite match up to the workload. Now, if somebody in the community, people, businesses, want to help support the mission, how can they do that, financially and otherwise?
Right. I mean, there's definitely less funding from federal, state level down. And so we have a philanthropy department, and we depend on that to help us provide extra services that we wouldn't be able to if we were just relying on our funding sources. And so if anybody's interested, that would be wonderful. We have a website at mhpcolorado.org, and on that website there's a donate tab. So that'd be great, and we would welcome any gifts, and that could be part of us being able to provide something. Like the Community Foundation helps us out, and then we provide extra group services. It supports that, as well as some of the employment services. So it'd be more than welcome.
If you had to tell people one thing, what would you tell them?
Well, as I think about this, I mean, doing this work is really meaningful, and that it can make such a difference. And I think people go for years and years, and they're just struggling on their own. And that people don't have to do this on their own, that there's help out there, and come and take advantage of it.
You know, that's fantastic, because you don't have to do it alone.
Right.
So hopefully,
Exactly.
hopefully at least one person watching this will hear that
I would love that.
and get the help they need. Well, thank you very much. I appreciate your time today, and here for the We Are Broomfield Community Spotlights. Again, this is Susan Vellas, Program Manager at Mental Health Partners of Broomfield and Boulder Counties. Thank you.
Thank you.
So now we're here with Dr. Jeff Almany, psychiatrist at Mental Health Partners. How are you today?
Good. How about yourself?
I'm doing well. Thank you for asking. So tell us a little bit about your role here at Mental Health Partners.
So I'm a psychiatrist. I'm trained as both child and adolescent and adult psychiatrist. And I see people pretty much throughout the age spectrum. I tend to see more children than adults, but I do see, I think my youngest is probably around 5 years old and my oldest is probably about 75 years old. So I'll see the entire age spectrum. I tend to concentrate more on kids and adolescents, but I do see plenty of adults. I'll see families where I'll see multiple kids in the same family. Once in a while, I'll see a parent and a child, if that's not going to be too much of a conflict. If it turns out that that's more of a conflict, then usually I'll see the child or the adolescent, and then one of my colleagues will see the parent. But I've been here 23 years, and so at this point I'm occasionally seeing children of people that I saw before, and so I feel a real connection to the community and to my clients here. Some of them I've known for a decade or more.
So not only do you work with people here in Broomfield, you actually live in Broomfield.
Yes, yep, just live probably less than 2 miles away from this building.
So you've been part of this community for a long time, and you were here before this building was here, when Mental Health Partners was, in various other locations before it
Yes.
co-located with Broomfield Health and Human Services.
We've been in a variety of different buildings over the years, and this is our most recent one.
So you deal with kids, you said, all the way from 5 adults up to 75.
Mm-hmm.
So in your work, what is the most rewarding aspect of what you do?
Seeing people get better, and especially with children and adolescents, their brains are pretty plastic and they're still growing and capable of a lot of change, and so you see people do much better with, and not just medication, of course, but a lot of it has to do with therapy and what the changes the family's able to make. Families come in here and they work very hard at trying to support their child and make the changes that they need to make for the child to do better. We interact also a lot with the schools, the local schools here. So I'm in frequent contact with teachers and principals and things like that about how to make things better for the student, whether it's a child or a teenager. And then occasionally interact with social services as well. We see referrals from social services for cases that they may have in families that are involved with the social services department.
So like Susan, you find that being co-located with Health and Human Services Workforce Center is a huge plus, that people have one-step shopping and you can interact
Mm-hmm.
with the other groups?
That is a plus. I think most people now realize that we're not part of social services, even though they're in the same building, and that can scare some people because they're worried that everything we say is going to then go right to social services, and that's not how it works. They would have to sign releases of information allowing us to share information with social services, but it is helpful to have everything here in one building.
Because you're not part of a city, county, or state government. You are a separate nonprofit, independent of all of those.
Yes, we've been part of Boulder and Broomfield counties for over 50 years, and we're a private, not-for-profit agency. So all the community mental health centers scattered all across Colorado and the United States were established by an act of Congress, and we're private nonprofits.
Okay, so you are part of a national nonprofit, Mental Health Partners.
No, we're our own individual organization, but they're, like in the state of Colorado, for example, different counties have their own community mental health centers. And so we're each individual organizations, but they're kind of like our sister organizations. And so some of them might be spread out across multiple counties, like on the Eastern Plains. And the mental health center there might have, 6 or 7 different counties, whereas Denver, the mental health center of Denver, is just Denver County.
Okay. Now that makes perfect sense because some of the Eastern Plains counties are very small populations
Yep.
spread out. You can't afford a large workforce at the mental health partners at that
Yes.
location.
And so we see people in Boulder and Broomfield counties, and we're responsible for seeing anybody who has Medicaid in Boulder and Broomfield counties. But we also see people with private insurance, we see people who are indigent, and we also see people from the surrounding area, because if you have Medicaid, even though you might live in Broomfield County, you can actually go to any mental health center to be seen, and anyone from other counties can also come here to be seen.
Do you have, living and working in the same community, do you have clients that maybe come from other communities because they don't want to deal with people in their community, maybe a smaller one? I do know in some of the rural areas, when they set up a call center for children for suspected child abuse, a lot of the smaller counties had problems because the person answering the phone usually knew the person calling, and then they felt there was some type of conflict. Have you ever felt that working and living in the same community?
No. I mean, I've been here for a long time, and I see my clients out in the community all the time, and that doesn't, bother me or worry me. A lot of times I see my family. A lot of times people don't recognize me because I'm dressed like this at work, and then out in the community I'm wearing a baseball cap or something, a pair of shorts. And so they don't always recognize me. And also, what I always tell clients is that if to protect their privacy, I won't say something to them until they say something to me, just in case they're with a group, let's say a teenager is with a group of friends.
Right.
And then if I say hi, then someone will say well, how do you know him? And, teenagers might not want to say, oh, he's my psychiatrist.
Right.
So, to protect privacy, I don't do that. But people usually say hi if they see me, or, if I'm with my family, they're particularly interested. Is that your wife? Is that your, are those your kids? That type of thing.
Yeah, that makes sense.
Yep.
Now, when we were talking to Susan earlier, she was telling us about the different kinds of therapy, the different strategies they'll use to combat mental health issues. Now, one of the ones she was talking about is group therapy. I would assume as a psychiatrist, most of yours are one-on-one?
Yes. So I meet with people one-on-one. When I first meet with someone to do an evaluation, that's an hour long, and then follow-ups usually half an hour long, depending upon what's going on with the person and what they need. But I work closely with the therapists. We have both individual therapy and group therapy here at the Mental Health Center, and we can also do in-home therapy as well. And I'm in close contact with all those therapists. And then we have regular meetings where we talk about clients and how best to help them and what some of the challenges might be and roadblocks to treatment and how to help them get over that, those type of things.
So not only therapy here, you actually have clients that'll do in-home therapy if needed?
Yes. Now, because of my schedule, I don't do the in-home therapy. I don't go to their homes. In the past, I would occasionally do that, but that usually, there's so many people to be seen at this point that it kind of precludes that, unfortunately. I actually used to enjoy going to people's homes occasionally because you learn so much more when you go to someone's home. But right now, the need is so great that I can't do that. But the therapists, there are therapists who actually specialize in going into the home and doing in-home work.
So you say the need is so great. What is the workload? What is the caseload here in Broomfield? We're a population that's rapidly growing, a city and a county. So what is the workload at this time, and is it increasing at this moment?
It's definitely increasing, and part of that's the increase in the population. Part of that was the Affordable Care Act enabled people to access services because they were able to get on Medicaid. So some people who had been quietly suffering for years because they didn't have insurance or a way to pay for treatment now could suddenly come in. And also I think the other thing that is helpful is that there's much more recognition of what mental illness is, and the stigma is gradually decreasing over time. Like, for example, I think about when I was in high school, no one would ever say I had ADHD or I had bipolar disorder, and now kids these days are much more free to talk about that having bipolar disorder or having ADHD or something like that. There's still stigma, but it's definitely improving. And I think people feel more comfortable coming in. And so I think that's why also more people have come in. And mental illness is very common. So there's lots of different types of mental illness. And so, we see quite a few people. We have hundreds and hundreds of people coming into our little mental health center here.
Yeah, we had heard from Susan earlier that in the next year, 1 out of 5 people will have some type of diagnosable mental illness.
Yep.
Which is really a staggering number when you think about it.
Yes.
And over the course of their lifetime, you have a 50-50 chance of having some type of diagnosable mental health illness.
Yep. And the way I kind of will explain it to families is, it's your brain's kind of like a computer, except it's far more complex than any supercomputer is. And you have 100 billion brain cells that have over 1 trillion connections. And so when you have something that complicated, there are going to be plenty of ways that things can go awry. And you can have hardware problems, you can have software problems, is how I often explain it.
It's a good way to look at it.
And we see a lot of that. And but the other nice thing is that we see people get better. And it's actually really gratifying to walk with someone while they're in that journey of getting better and recovering from their mental illness. And the way I often explain it to kids and families is that the person's the quarterback, family members are the coach, I'm the assistant coach. And we're all working together towards winning.
So we've been talking to Dr. Jeff Elmany, psychiatrist here at Mental Health Partners. Dr. Elmany, thank you very much for being here with us today.
And thank you for the opportunity to speak.
My pleasure.